Tamara Prosper, and I'm your elder care coach. Today I want to talk to you about urinary tract infections, also known as UTIs. To most younger people, a UTI is just something that's really annoying and usually pretty painful, but it's over quickly, you move on, it's done. In the elderly, a UTI can go from being annoying to dangerous very quickly, and here's why. The symptoms are totally different. Most of the time they don't have the burning or the frequency of having to use the bathroom. They don't even notice it. The symptoms are different, causing them to go unnoticed and then untreated until it becomes something far worse. The biggest warning signs of a UTI are sudden confusion and extreme change in behavior. Let's say your grandmother prepared a really big meal for the family on Sunday. She cooked everything that everybody likes, did it all by herself. This is Sunday. By Tuesday, she can't figure out how to make the stove work properly. She could very well have a UTI. Or let's say your uncle, who's usually really sweet and gets along with everybody, all of a sudden becomes a grumpy old man. He probably has a UTI. In any case, your loved one needs to see a doctor as soon as possible, who will most likely run a urinalysis to check to see if they have a UTI, and then prescribe an antibiotic for them. Why are UTIs so bad for the elderly? It's a bacteria that grows in the urinary tract. The longer it goes untreated, the more likely it is to go farther into the urinary tract, up to the bladder, and into the kidneys. If it's in the kidneys and untreated, it could lead to sepsis, which is a blood infection. The people at greatest risk for a UTI are people who are diabetic, women who've gone through menopause, and people who have had kidney stones. The best ways to prevent a UTI are drink a lot of water. My kids said I'm a little crazy with this, but I mean it. Drink a lot of water. You have to flush everything out of the system, and water is the best way to do that. Also, making sure that the genital area is always clean. So make sure if you recognize in your elderly loved one a sudden change in their normal behavior or a sudden onset of confusion, get them to the doctor and check. Remember, you can do this.